Let's review the respiratory system. We first start with a semi-head model. This is a mid-sagittal cut. The entrance into the nasal cavity is through the external nares. And then we have a large space here, and that is the nasal cavity. In this area, what we do is we humidify and we warm the air. One of the things that we have here in the nasal cavity is we have three conchas. We have a superior, a middle, and an inferior concha. We have channels that go below the conchas, and I will show that on a skull in a minute because you can see it, and those channels are called meatai or meatus for one of them. So there's a superior, a middle, or there's two superior, two middle, two inferior ones. I want to just visualize the conchas on a skull, on a real skull, because it's very difficult to see on plastic models. And essentially what we're looking at here, right here, this is an inferior nasal concha. And behind it, where there's a space, that's the meatus. So behind the nose, we have the part of the pharynx that's called the nasopharynx. Behind the mouth, we have a part of the pharynx called the oropharynx. And behind the, in the area of the larynx, we have a little piece called the laryngopharynx. Nasopharynx, oropharynx, laryngopharynx. And then after, below the pharynx, we have the trachea, where the wind goes in, the windpipe. And we have the esophagus, which is collapsed right here, and that's for the food. Let's look at a larynx model. On top here we have the hyoid bone. Then we have this big cartilage, which is a shield-like cartilage. That is known as the thyroid cartilage. With the tip of it, we know that as the laryngeal prominence or the Adam's apple. This cartilage is hyaline cartilage. Most of the laryngeal cartilages, as well as the tracheal cartilages, are hyaline cartilage. There's one exception. So when we have the hyoid bone and then the trachea, we have a ligament in between, and that ligament is called the thyrohyoid ligament. Below the thyroid cartilage, we have a ring-shaped cartilage. We'll see the back in a minute. It's called the cricoid cartilage. And we have the cricotracheal ligament connecting the cricoid cartilage with the tracheal cartilage. Right here. Then inferiorly to that, we have the tracheal cartilages right here. So the first ligament between the cricoid and the tracheal is known as the cricotracheal ligament, and then after that, between the rings, the C-shaped cartilages of the trachea, we have what's known as an annular ligament. When we look from the back, we see on this side of the model, we see that, well, we see that the thyroid cartilage is open in the back. Then the only one that's closed in the back is the cricoid cartilage, and it gets really fat and big in the back. And so that is that's why sometimes they call this a signet ring-shaped cartilage, because it looks like a signet ring in the back. And then you can also see here that the back of the tracheal cartilages are not closed, they're open. And we saw that and the reason why they're open is because this here will be the esophagus. So when we have the esophagus in the back and we swallow something big, it can push into the trachea and will not push into the vertebral column, which will be right here. The esophagus, if it's not, there's no food or liquid in it, is going to be closed. When we go further up, behind now the thyroid cartilage, we have these sort of spoon-shaped cartilages on the side, 2 of them, and they're known as the arytenoid cartilages. And then the top portion of it, what you can see right here, breaking off a little bit, is coming off a little bit, is the corniculate cartilages. What we can't see that well on this model, but we try, is the vocal folds and the vestibular folds. So as the windpipe goes down, we have folds that cover the hole, or the tube. We have vestibular folds that make like a little roof shape on top the hole, and they are not here to do anything other than protect the trachea from having substances enter that should not enter, particulate matter. And then medial to the vestibular folds, the vocal folds. The vocal folds are very highly elastic ligament, and they act like guitar strings. As the air comes out and they are situated, positioned in a specific manner, they'll make sound and they vibrate. The hole where all that goes in between the vocal folds, we call that the glottis. This flap thing is called the epiglottis right here. And the epiglottis is not hyaline cartilage, the epiglottis is elastic cartilage. And what its job is, when we swallow, what happens is we bring the tracheal cartilages closer to the hyoid bone, but the epiglottis stays in place. And essentially what that will do, it will close the epiglottis posteriorly, it will fold down and will cover the glottis. So that's the primary way we can stop larger particulate matter from entering the trachea when we swallow and eat. And underneath we have the vestibular folds making sure nothing goes in.